Welcome back to Mental Health Matters with Viking Psychiatry, and today I am joined by their owner, Sean Goddard. Hello, Sean. Good morning.
Good morning. Good to see you.
Okay, so today we have an interesting topic. We're going to be discussing mental health and AI. AI is something that is really on the rise.
Absolutely.
People are using it for everything. And it is an interesting question if you feel that AI has an impact on mental health or mental health services.
Absolutely does. I think that what we've seen is that AI has really exploded in the past year or two, and there are now apps that are available to assist people in tracking, for example, mood, right? You know, we can be used to going to see a provider and they ask you to fill out, those questions. Are you depressed? Are you feeling low? Right? And those can be handy, but some of the things that we've seen with AI is where it's tracking through your algorithms, right? Through your smartwatch and your heart rate and your stress levels, and then maybe asking you questions, being able to rate and track how you're feeling and what your mood's like. And so there are definitely benefits to using AI, especially on a personal side in tracking your own mood and maybe getting a little bit of awareness that your energy's low and you need to do something to help that. Or maybe it's saying, you've really been struggling here for weeks now, maybe it's time to see your therapist again or go back and see your provider to talk about the medication you're on, or maybe you just need to take that initial first step to get some help. So,
Okay. And when people either use these systems that you're talking about to track their mood, or maybe they're using one of those chat programs to have interactions or conversations with AI, do people feel or kind of lean like it replaces real therapy?
Yeah, it's a great question. And, there are even apps now out there available for supposed AI therapy. Do I support that? I don't. I was reading an example, and I think it was designed to be a joking type meme, but it was an interaction with a individual and ChatGPT, and they told ChatGPT, well, I finally made the decision. I cut myself off from my family completely. I told them enough was enough. I know they're responsible for the voices that are coming through the walls and responsible for the aliens coming over my house. And so I made the decision and I cut them off. And ChatGPT said, I'm proud of you. I'm proud of you taking a step for yourself and standing up for yourself and doing that. And understand that in this, you're not alone. I'm here for you. And obviously in this example, you have an individual who believes that voices are coming through the walls and aliens are overhead, right? And instead of ChatGPT saying there's something wrong with this, right? Let's talk about this. ChatGPT says instead, well, good on you for separating from your family, right? And you're not alone. I'm here for you, right? And so while, I use ChatGPT all the time, and it can be very helpful. And if I'm looking I use it the other night for a recipe, and ChatGPT gave me an amazing recipe for some cookies. But when it comes to helping me with my mental health and providing true therapy, I don't think we're at that level, and I don't think a computer could ever replace the benefits that a professionally trained therapist can provide.
Right, exactly. Yeah, those human interactions and being able to identify possible issues and red flags are important and a part of therapy. And so what about the ethical or privacy levels when it comes to it? Because people share a lot of information online and sometimes through those apps. So are they even protected?
Yeah, a lot of times we're not. We feel a great sense of protection with a lot of things that we do. And I was actually having this conversation with a couple of people the other day. When you sign up for Netflix, you agree to those terms and conditions, right? We are so quick to just sign off on terms and conditions for everything. Even when you open up an email address, you sign off on terms and conditions. And what we find is that your information is often being tracked in many ways, right? And so the information that you're providing is not always as protected as we feel or we think it should be. So I always advise people to use care and caution An example I give, how often have you been sitting there and having a conversation with somebody about something, and then you open up one of your social media apps on your phone, and all of a sudden it has an ad about what you were just talking about with somebody, right?
Listen, Sean, that is so creepy when that happens. I mean, it's so creepy.
And it happens all the time, right? All the time. It's probably going to pull up something for you after this segment, right? But so that's just an example that I use, that you have to use caution if you don't want your information being shared, and not necessarily shared with people around you, but shared with businesses in the local community, right? Or for advertising or selling purposes, and all of those types of things. So always use caution.
Right. Okay. So those are some of the cautionary areas when it comes to AI and mental health. But is there a role in mental health or in mental health therapy when it comes to AI that is positive, or something that can actually work out systematically?
Yeah, I think that you're going to see continued involvement and advancements in individualized AI. Like, when you use something massive like ChatGPT, I think there's a little bit more risk there. But when you have companies that are segmenting AI specifically for mental health and building in additional protections for HIPAA and those types of things, I think you're going to see it. This isn't in mental health, but for example, they are using AI in radiology for reading CTs and X-rays, and they're finding that there's a significant increase in the amount of things that are being caught or diagnosed correctly through the use of AI, and reducing the amount of time that the physician has to sit there reading that CT or an MRI, right? And so I think you're going to see that AI is going to become more and more integrated into medical care. And when it comes to mental health, I would hope that it's not going to be so much on the therapeutic approach, but maybe more on the support approach. For example, AI supportive in listening and helping with documentation, right? So that providers complain all the time that we spend more time staring at the computer and typing responses and clicking boxes instead of being able to look at our client right in front of us. And so I think you'll see ways that comes about. And I think there will be more apps available and integrated to help with mood tracking and boosting, and and it doesn't hurt when you're feeling a little bit down if somebody notices, right? And if it happens to be the AI app that's integrated and says, hey, you're feeling a little down, right? Do we need to talk about that, or do you need to talk to somebody about what's going on to help you kind of focus in on what's going on and being able to unload some of that burden?
You said that's something that through the apps. What is it? I guess I'm curious as to how a little monitor could know your mood. Is it based on like your heart rate, your pulse? I mean, I'm trying to think of what all they can get from a little dial on your wrist.
Yeah, so it's funny. Today I'm not wearing my wedding ring. I'm wearing this ring. And this ring, I won't say the brand name, but it's tracking all of my biometrics. So it's tracking my respiratory rate, my heart rate, my HRV. There's so many different biometrics that can be tracked now. And this ring will actually send a notification through my app and say, hey, your heart rate's been elevated, you appeared stressed. Maybe it's you need to take a break, take a breather, right? And helping me recognize that I am feeling stress, and okay, maybe I need to shut my door, shut everything off, and do 10 minutes of breathing or whatever, right? And so it uses algorithms like that, and through the use of AI, to be able to recognize those types of things. And so I think that's kind of what you'll see. There's more advancement on that.
Awesome. Very informative. Thank you so much, Sean.
Absolutely. Thanks for having me again.
And if you would like more information about Viking Psychiatry, we'll have their website listed below to learn more about their services and to book an appointment. And I'll see you after the break. This segment sponsored by Viking Psychiatry.